Hello viewers, welcome to my channel. Today's video will be slightly on the nose because in today's video I will talk about deviated nasal septum or DNS. More specifically, I will talk about how we as doctors should approach the treatment of a patient with deviated nasal septum. So let's get into it. The outline of today's video will be, first I will talk about what nasal septum is, what are its different parts. Then we will talk about the different symptoms that a deviated nasal septum can produce. Then we will talk about how to take history in a patient with deviated nasal septum. Briefly, we will discuss the examination of the nose. And finally, we will talk about how to diagnose a patient with deviated nasal septum and how to treat the disease. So without further ado, let's get into it. So what is nasal septum? Nasal septum is basically a midline structure which divides the nose into two nasal cavities. Although nasal septum is a midline structure, almost always it is not completely straight. However, only when the deviations in the nasal septum start producing symptoms do we need to think about starting treatment. Now, nasal septum has three parts. From front backwards or from anterior to posterior, nasal septum can be divided into three parts: columellar septum, membranous septum, and septum proper. Columellar septum and membranous septum are both lined by skin, so this is the part of the nose that also can have hair, which technically is called nasal vibrissae. Septum proper has major components and minor components. The major components of septum proper are one cartilage and two bones. What is the name of the cartilage? The name of the cartilage is very simple: septal cartilage. However, if the examiner wants to know a little bit more, you can also say quadrilateral cartilage because this cartilage looks like a quadrilateral. Behind the cartilage lie two bones. Above is the perpendicular plate of ethmoid and below is the vomer. So this septal cartilage, perpendicular plate of ethmoid and vomer constitute the major components of nasal septum. There are some minor components as well. Right at the back is the rostrum of the sphenoid. On the dorsal aspect, that is the upper part of the nose, from behind forwards, there is the nasal spine of frontal bone and there is the crest of the nasal bones. It's important to remember here that nasal bones and bones in the nose not the same thing. There are two nasal bones in the human body and there are many bones in the human nose. In fact, nasal bones are the most frequently fractured bones in the facial skeleton. Now, if you remember the skeletal structure of a skull, you would understand that the nose on a skull looks slightly different from the nose in a human body, normal living human body. Why is there a difference? Because the skeleton only contains bony structures and the nose contains not just bone but also soft tissue like skin and cartilage. Of course, these will not be present in a human skeleton. So, beyond the crest of the nasal septum, anteriorly, that is forward, on the upper surface is the cartilage, of course under the skin. What cartilage is this? This is the medial crura of the upper lateral cartilage, also the dorsal border of the septal cartilage. So this is the dorsal aspect of the nose. The floor of the nose is largely a bony structure. From forward backwards you have, or from anterior to posterior, the first structure is the anterior nasal spine of maxilla, followed by the crest of maxilla, followed by the crest of palatine bone. So now we know what are the different constituents of the nasal septum. Now let's move on to the different symptoms that nasal septal deviation can produce. What are the different symptoms that a deviated nasal septum can produce in a human being? I can talk about 7 right now. Number 1 is nasal obstruction or a feeling of blocked sensation in the nose. Number 2 is headache. Number 3, smell problems like decreased smell perception or even absence of smell perception. Number 4 is bleeding from nose, the technical term for which is epistaxis. Number 5 is external deformity in the nose, that is crooked nose or some problem with the shape of the nose that is externally visible. Number 6 is sinusitis and number 7 is middle ear infections. Let's discuss each of them one by one. Let's talk about obstruction in the nose produced by deviation in the nasal septum. Now, common sense will tell us that if the septum is deviated more towards one side, the patient will experience obstruction on the same side. However, patients often experience obstruction on the other side, that is the more roomy nasal cavity. Why is this the case? Is the patient lying? Usually patients don't lie. So we have to take their complaints seriously and understand why these complaints are happening. If the nasal cavity has become more roomy, why is the patient having complaints of blocked sensation in that nasal cavity? To understand this, we have to understand some functions that the nose plays. The 3 important functions of the nose are air entry, that is respiration, humidification of air, and smell sensation. Now in this case, for humidifying of air, the nasal mucosa plays a very important role. When in the roomy nasal cavity more air is entering, the nasal mucosa has to do more work to humidify this increased volume of air. In order to humidify this air, the nasal mucosa undergoes hypertrophy, especially near the inferior turbinate. This phenomenon is known as compensatory hypertrophy of inferior turbinate, and this can be an explanation why patients complain of obstruction in the more roomy nasal cavity when they have a deviated nasal septum. Of course, on the side which has the deviation, that is deviation towards the right side, will have a narrower nasal cavity on the right side, and there will be obstruction on that side as well. So typically patients will complain of obstruction on the right side as well as obstruction on the left side. Now this obstruction is sometimes cyclical in nature, which can be explained by a phenomenon known as nasal cycle. Nasal cycle basically states that around an interval of about 6 hours, one nasal cavity functions for inhalation and exhalation. Basically, both nasal cavities are not functioning at the same time. So when one nasal cavity is functioning and the other nasal cavity is narrower, patients sometimes experience nasal obstruction on one side and then it alternates to the other side based on which nasal cavity is active at that stage. So I hope you understood why nasal obstruction is seen in patients with deviated nasal septum. Now let's move on to why there is headache in a patient of deviated nasal septum. Now let's talk about why is there headache in a patient with deviated nasal septum. Now, deviation in the nasal septum can be of various degrees. It can be a very big deviation, so much so that a midline septum can be deviated to an extent that it comes in contact with some part of the lateral nasal wall. Now when there is contact between these two surfaces, there may be friction, and this friction can produce headache. This is also known as pressure headache or contact point headache. This is typically seen when the nasal septum has a spur, that is a sharp angulation, and this spur is touching the inferior turbinate. This is known as pressure headache or also known as contact point headache, and this is the possible explanation why patients with deviated nasal septum can have headache. Moving on, patients with deviated nasal septum can also have bleeding from nose, which can be explained by 2 phenomena. One is the stretching of the vessels, blood vessels, over a septal spur. As I mentioned previously, septal spur is a sharp angulation in the nasal septum, that is a sharply deviated nasal septum. The blood vessels lying on top of this deviation can get stretched and it can even tear, leading to bleeding from the nose or epistaxis. The other explanation of bleeding from the nose in a patient with deviated nasal septum is the formation of crusts inside the nose. This can be there because maybe all of the air that is entering the nose cannot be humidified, which leads to crust formation, and upon removal of these crusts there can be bleeding from the nose, which is also known as epistaxis. So these are the 2 possible explanations why patients with deviated nasal septum can have bleeding from nose. Patients can also have problems with smell sensation, or the technical term is olfaction. Why is this the case? The olfactory area of the nose lies near the roof. If the patient has a deviated nasal septum near the roof, which is also known as high up DNS, this can prevent air from reaching the olfactory area. So if less air reaches the olfactory area, less smell perception is there in that patient, which is known as hyposmia. If no air is entering, which is very rare, then the patient may even have absence of smell perception, which is known as anosmia. There are other abnormalities in smell sensation, such as phantosmia, which is perception of a smell that is not there, also known as olfactory hallucination. There can be cacosmia, which is a permanent perception of foul smell. There can be parosmia, which is perversion of smell perception, that is, pleasant smell can be perceived as foul smell and vice versa. And there is also something called olfactory agnosia, which is lack of the ability to remember smell. These are some smell related abnormalities. However, in patients with deviated nasal septum, the commonly encountered smell abnormalities, if at all, is hyposmia and very rarely anosmia. Moving on, deviated nasal septum can also present with external deformity or external change in the shape of the nose. Why is this the case? To understand this, we have to understand the various causes of deviation in the nasal septum. One cause of deviation in the nasal septum is trauma, that is a blow to the nose. This can be due to physical assault, it can be due to an accident. So an accident or a blow or a trauma which can cause deviation inside the nose, that is in the nasal septum, can also produce a deviation externally visible. So this is a possible explanation why there can be external deformity in the nose in a patient with deviated nasal septum. So it is very important when you are communicating with the patient with a deviated nasal septum that you make it a point to ask the patient whether they experienced any trauma in the past or not. Okay, and the other complaints that the patient can have are sinusitis and middle ear infection. Sinusitis can happen if the deviated nasal septum can get deviated to an extent that it is blocking the sinus ostia, that is the openings of the sinus, especially in the middle meatus. And middle ear infection can happen if the deviation is happening to an extent that it causes eustachian tube abnormalities. Eustachian tube or pharyngotympanic tube, as the name suggests, has two openings, one in the nasopharynx and the other in the anterior wall of the middle ear. So it connects the ear with the nose. If there is a problem with the nasal septum, that is, there is a deviation which is causing problems with the nasopharyngeal opening of the eustachian tube, this can lead to problems in the middle ear. Even infections from the nose can get transmitted to the middle ear, which is known as ascending infection, and this can result in infections in the middle ear. So these are the possible symptoms that a patient with deviated nasal septum can have and the possible explanations why these symptoms can occur. Let's move on to how we should approach a patient of deviated nasal septum from a long case point of view. This will be very beneficial, particularly for MBBS and MS ENT students. Now let's look at deviated nasal septum from the point of view of an MBBS ENT student. Deviated nasal septum is a frequently asked question during the practical exam, and it can be a question that forms what is known as long case. Now, if you are not familiar with long cases, basically it consists of two parts. The first part, you communicate with the patient and prepare an answer, and in the second part, you present your answer to an examiner who asks you pertinent questions. Now, any long case in any clinical subject follows a fixed template. It includes history, clinical examination, summary, differential diagnosis, and provisional diagnosis. History can be further subdivided under following headings: patient particulars, chief complaint, history of present illness, history of past illness, personal history, family history, and treatment history. In terms of examination, there is general examination, systemic examination, and local examination. We will talk only about history of present illness and local examination in this video, because these are the two most important parts of the long case answer. In fact, the answer is as good as the history of present illness and the local examination. Also, most examiners ask maximum questions from these two parts of the answer. So let's focus on history of present illness and local examination. What is history of present illness? History of present illness is basically elaborating on the complaints that the patient has, describing those complaints properly, including the duration of the complaints, the precipitating factors, the relieving factors, whether it is progressive in nature, whether it is sudden in onset, other factors like that. So describing the complaints is one aspect of history of present illness, and the other aspect of history of present illness is asking relevant questions to obtain relevant negative history. Now, in order to construct a proper history of present illness, one needs to know what are the possible symptoms that a patient can have with a particular disease. Now, I have already discussed the symptoms that a patient can have with deviated nasal septum. So if you know what the possible symptoms are, you know exactly what questions to ask to create the history of present illness. Again, to reiterate, history of present illness is the single most important part of the history in long case. Now let's move on to local examination. At the very outset, I must mention here that local examination in ENT is examination of ENT. Even if the pathology is in the nose, you have to examine the ear as well as the throat. Of course, if the pathology is primarily in the nose, then you start with nose examination. In this video, I will only talk about the examination of nose. Examination of nose can broadly be divided into two parts: structural examination and functional examination. Structural examination again has four parts: examination of the external nose, examination of nasal vestibule, anterior rhinoscopy, and posterior rhinoscopy. Functional examination has smell tests and nasal patency tests. Let's talk about them one by one. Let's talk about examination of the external nose. Examination of external nose has inspection and palpation. On inspection, we can understand whether there is any abnormality in the shape of the nose, such as crooked nose or hump on the nose or a saddle nose deformity, or if there is any swelling on the nose. All these things, scar formation, sinuses, all these things can be observed just by inspection. Apart from inspection, there is palpation of the nose. Palpation of the external nose can help in detection of tenderness, tenderness, local rise in temperature, crepitation in the cases of fracture of the nasal bone, and other things. For the nasal vestibule, one needs to ask the patient to look upwards so that nasal vestibule can be seen. Nasal vestibule is again examined for furuncle or any swelling or any deviation. Then we perform something known as anterior rhinoscopy. In order to perform anterior rhinoscopy, three instruments are required, or at least two instruments are required: thudicum nasal speculum and a light source. The traditional source of light is a bullseye lamp, the light from which is reflected from a head mirror and then focused on the nasal cavity. The thudicum nasal speculum is typically held in the non-dominant hand. The dominant hand is used to stabilize the head and gently tilt the nasal tip upwards. The thudicum nasal speculum is introduced with the prongs closed and is withdrawn with the prongs slightly open to prevent any trauma to the nasal vibrissae. With the anterior rhinoscopy, one can examine most parts of the nasal cavity except the posterior most part and the anterior most part, that is the vestibule. Other parts of the nasal cavity like the nasal septum, the floor of the nasal cavity, inferior turbinate, middle turbinate, and with difficulty the roof can be seen with anterior rhinoscopy. So we can comment on any deviation in the nasal septum or any foreign body or any discharge or any other abnormalities in the nasal cavity. To see the posterior most part of the nasal cavity, we have to perform a procedure called posterior rhinoscopy. Again, even in this procedure we need light, so bullseye lamp and head mirror appear again. We need a mirror which is called a post-nasal space mirror or PNS mirror. This mirror and we also need a tongue depressor. The tongue depressor is held in the non-dominant hand to depress the tongue by placing the tongue depressor at the junction of anterior 2/3 and posterior 1/3 of the tongue. This depression of the tongue increases the space available in the oral cavity to facilitate the introduction of the posterior nasal space mirror to perform posterior rhinoscopy. The mirror surface faces upwards and the light is focused on this mirror surface. It gets reflected and shows the image of the nasopharynx. Now, if there is any abnormality in nasopharynx like adenoid hypertrophy or presence of any polyp, and of course normal structures like the posterior end of the turbinates and the posterior end of the nasal septum can be visualized on posterior rhinoscopy. Important point to remember is, before we introduce the post-nasal space mirror, we have to warm it, either by dipping it in warm water or by heating it over a spirit lamp. When we heat it over a lamp, we should heat the mirror surface and we should test how hot the mirror is by touching the metal surface on the back of our wrist so that we don't cause any trauma to the patient. Also, very important to remember here is, while we are introducing the post-nasal space mirror, we should not touch any structure in the oral cavity because that may induce gag reflex and make it especially uncomfortable for the patient. With this, we have concluded the structural examination of the nose. Now let's move on to the functional examination of the nose. Functional examination of the nose basically includes nasal patency tests and smell test. Smell test is quite simple. We provide the patient with commonly known smells like peppermint, coffee, etc. in boxes which are not labeled. They should be identical boxes and the patient should keep their eyes closed and they should be asked to identify the smell correctly. There are some standardized kits available for smell testing like the University of Pennsylvania smell identification test, and some other protocols are also there. However, from the point of view of MBBS ENT, just using the commonly known smells is adequate for smell testing purposes. Now there is the nasal patency test. Important point to remember here is, Cottl's test is not a commonly performed nasal patency test because Cottl's test is only for the nasal valve area. For the entire nasal cavity, the two commonly accepted tests are cold spatula test and cotton wool test. Cold spatula test is performed by using a tongue depressor. Again, this tongue depressor is not kept in the refrigerator. It is considered cold because this is not hot. Okay, that's as simple as that. The blade surface of the tongue depressor is kept just below the nasal cavities. Patient is asked to inhale deeply and then exhale forcefully. Then the mist formation on the blade is observed. If there is equal mist formation corresponding to each of the nasal cavities, then both nasal cavities are perceived to be patent. If one nasal cavity produces less mist, then that nasal cavity is perceived to be less patent. With cotton wool test, we keep a cotton wool near one nasal cavity. We ask the patient to close the other nasal cavity and exhale, and we monitor the movement of the cotton wool. If on exhaling the cotton wool moves, then that nasal cavity is perceived to be patent. The same test is repeated on the other nasal cavity. So with this, we conclude local examination of nose, and if we can examine the nose properly and we can write history of present illness properly, we will be able to correctly create a list of diseases which can explain the symptoms. Of course, the positive examination findings and the positive history findings should be documented in a case summary. So case summary only includes positive findings from history and positive findings from examination. These positive findings will help us create a list of diseases which can explain these findings. This list is what we call a differential diagnosis. A differential diagnosis should include the list of diseases in the order of likelihood. Most likely disease should be at the top of the list and least likely disease should be at the end of the list, that is the bottom of the list. With all this out of the way, finally we arrive at the provisional diagnosis, and provisional diagnosis should be written in this manner. Based on history and examination findings, my provisional diagnosis is deviated nasal septum with convexity towards right or towards left or towards both sides in S-shaped deviation, or with the presence of a spur, or there is a midline thickening, or there is an anterior dislocation. These are the different types of deviations in the nasal septum. So I hope this video helped you. I hope you have understood what deviated nasal septum is. Now we come to how to treat this condition. The treatment of this condition is largely surgical, and the most commonly performed surgery is septoplasty. The earlier surgery that used to be performed was known as submucous resection of nasal septum. It is still performed in some cases, but septoplasty has largely become the more popular surgery, and it has largely replaced submucous resection of nasal septum for all practical purposes. In a future video, I might talk about septoplasty and how to obtain consent for it, and what are the possible benefits and the possible risks associated with it. So I hope you like this video. If you have any feedback, if you want to make any corrections, I'll be happy to hear from you in the comment section. Thank you for watching this video. Take care. Bye bye. And a big thank you to the person holding the camera for such a long time. Please don't forget to be awesome.